Good evening and thank you for joining us. There are 5 new COVID-19 cases in northwestern Ontario today. 3 come from the Thunder Bay District Health Unit catchment area and the other 2 in the western part of the region. Of the 3 new cases confirmed by the Thunder Bay District Health Unit, 2 come from the Lac des Îles mine, a man in his 40s and another in his 50s. There are now 14 total cases from Lac des Îles. The 3rd new case, a man in his 20s, was exposed through close contact with someone who had previously been infected with COVID-19. There have now been 49 cases in the Thunder Bay District. 22 of those are resolved, while 363 others are still awaiting results. In all, 1,137 tests have been administered. Elsewhere in the region, the Northwestern Health Unit has 2 new cases, one in Atikokan related to Lac des Îles, and the other is the first known case from Kenora and is due to out-of-province travel. That health unit has now recorded 12 positive tests. 9 of those have been resolved. Ontario has recorded its single largest increase in COVID-19 cases since the outbreak began. 564 new cases are being reported today, with 55 new deaths. That brings the overall number of cases in Ontario to more than 9,500. Meanwhile, the government is examining the risks of when and how to reopen the economy. Colin DeMello has more.
As Ontario healthcare workers try to contain the spread of the virus, politicians at multiple levels are trying to blunt the impact on the economy, looking at the best way to get back to normal.
If you open restaurants, do you open all the restaurants entirely at the same time? Do you open half the restaurants? And if so, how do you decide which ones get to open? Do you open all the restaurants but say they can only be half full or a third full to allow you to have some degree of physical spacing?
Last night, Prime Minister Trudeau convened a phone call with Canada's premiers to discuss the reopening of the Canadian economy. Sources say it is an early conversation to determine what factors should be used in making that decision.
He recognizes that every part of this country is different. BC's a little ahead of us because it hit them first, and they'll probably start off. I know Alberta, they wanted to move forward very cautiously, but we're going to do this in a methodic way.
COVID-19 has already taken a massive economic toll. 400,000 jobs lost in Ontario so far, forcing the province to run a $20 billion deficit to dig our way out. But the government seems to be walking a fine line. Lift the voluntary lockdown too soon and risk spreading the virus. But do it too slowly and more people could lose their jobs. The federal government says it wants a coordinated approach,
so that we can maximize our chances of getting through this without having to fall back into self-isolation the way we have been these past few weeks.
For Ontario, that means unlocking the economy in stages.
When the time is right, and do it methodically, move it out very, very slowly and cautiously. We aren't going to be out there opening up the floodgates, but once we get going, it's full steam ahead.
But there are still signs that this will last a while. Canada Day will be celebrated virtually this year, and Ontario's education system is preparing for the possibility of virtual learning in September.
If we get the impression that we need to add more supports or take additional measures leading into the next year, we'll do it. We're looking at every option to ensure no child has a gap of learning.
This pandemic is unpredictable, and so too is its impact.
Though resources are limited, Thunder Bay's Regional Hospital can now perform same-day COVID test analysis for high-priority cases. This comes as Public Health Ontario has put an added focus on the Northwest, and hospital officials say even more help from the province could be on the way. Corey Nordstrom explains.
Local wait times on COVID-19 tests have ranged from 2 to 6 days, and it seems as though frustration from officials at the Thunder Bay Regional Hospital have paid off. Here's what the hospital's COVID-19 incident manager said on Friday.
We had a number of test kits delivered a day ago, and so now we have probably about 60 to 80 test kits that we can do priority testing here at the hospital within sort of 2 to 3 hours, actually.
Kennedy says they have already used some of those tests and expects them to last a week, noting they could be spread further. But even more help could be on the way from Public Health Ontario, knowing the concerns with turnaround times for tests locally.
They want to set up a lab here in Thunder Bay. They'll have to bring up a whole module here in Thunder Bay to the public health in Thunder Bay, where they can actually do. We don't need to test kits. We can do the extraction of the sort of the RNA from the viral particle, and like they do at the Toronto lab in Toronto.
Kennedy says that mobile lab could come in the very near future, but he was quick to point to the fact that the hospital has been hopeful to receive testing reagents for weeks now.
I'm a bit cautious, you know, for the community that we're going to get it here, but I think everything's going in the right direction, so I am confident.
Kennedy also gave an update on their new COVID unit and said with just 8 patients in their hot zone, there is cause for optimism. There are currently 19 patients with presumptive cases at the hospital and 3 confirmed cases, with 2 in the ICU. And with regional hospitals having limited numbers to deal with cases, Kennedy says they have room in Thunder Bay for patients from across the Northwest.
Certainly want to support the docs up there in the region dealing with difficult patients, so it won't pose a threat at all. Right now, I think we have 4 individuals on respirators or ventilators in the ICU right now, and we have a lot of capacity right now to up to about another 20 or so. So we're okay. We're well situated right now.
Corey Nordstrom, TBT News.
On top of the COVID-19 concerns, Regional Health Sciences Centre officials are dealing with a major privacy breach as well. It involves the personal records of dozens of hospital employees. Officials told TBT News spoke with would not talk about the breach on the record, and a request for an on-camera interview was declined. But according to a report by CBC News, the records of more than 200 staff members were published on the hospital website at the end of March. The data included names, social insurance numbers, and financial information, and reportedly remained on the website until early April. Affected staff were informed of the leak by letter. The hospital explained the decision to refuse comment by saying their focus remains solely on dealing with the COVID-19 pandemic. Well, it's now time for our latest update from Mayor Bill Morrow. A virtual town hall meeting is being planned for next week. The gathering will take place online, and members of the community are encouraged to reach out.
So over the course of the last few weeks, I've been doing my best to communicate back to the community through a variety of mediums, social media, press releases, doing this piece here at Thunder Bay Television, radio and the like, to try and keep the community informed as best I'm able about changes that are occurring within the municipality, city services, different orders that are coming down from the province of Ontario. Today, I'd just like to share and announce that on Tuesday, April 21st at 7 p.m., I will be hosting a virtual town hall. Along with Dr. Janet DeMille from the Thunder Bay District Health Unit. We'll be in a position for an hour or so to take your calls by phone or online. If you're looking for a way to get a hold of us and to be part of that, look for the city media release or look to the City of Thunder Bay website for details on how to tap into that. Once again, that'll be happening Tuesday night, April 21st at 7 p.m. I hope to hear from you then. Thank you.
Mayor Morrow will be back with another update to the community on Monday's News Hour. An Edmonton band councillor who was the first confirmed positive COVID-19 case in a Northern Ontario First Nation says more needs to be done to keep the virus from spreading through vulnerable communities like his. Andrew Yesno feels fine but has been self-isolating since he returned to the community from Thunder Bay late last month. That's where he believes he became infected, though that hasn't been confirmed. He received his positive test result on April 5th. Yesno says while upper levels of government have stepped up cooperation recently and materials for a temporary COVID-19 assessment center should be flown in soon, initially the community was left to deal with the problem on its own. Edmonton has had to secure its own personal protective equipment for its health professionals, and Yesno says in his case he doesn't believe outside health organizations like the Thunder Bay District Health Unit did timely contact tracing.
Myself, a couple days later, and they had never been contacted by the health unit or anybody. And the local contacts here were just the person who drove me and his girlfriend. And I told them to get tested, and they were turned around and told that they were low risk, and they weren't. And in fact, he was just tested yesterday.
The health unit has previously stated it will not comment on individual cases. The Ontario Cannabis Store saw sales skyrocket last month as residents stocked up for longer stretches of time at home. A new report today says sales have increased by as much as 600% since the beginning of March. Analysts say it's a sign cannabis is becoming a regular part of consumer spending alongside other goods. The province has allowed brick-and-mortar cannabis stores to stay open for pickup and delivery only. The RFDA and the local Salvation Army welcomed a huge turnout today for their COVID-19 Safe Food Bank at the CLE grounds. Before the gates were even open, more than 1,000 people had pre-registered. Michael Mahorovich has the details.
The RFDA supplied and packaged the food, while the Salvation Army handled logistics and organization. Between 10 in the morning and 1 in the afternoon, over 700 food handouts were processed. Some people received one hamper, while larger families were given multiple hampers. RFDA Executive Director Volker Kram says because of COVID-19 and major job losses locally, they've seen an increase in demand of roughly 25%.
I was anticipating maybe 5-10% more people coming because of layoffs and the people that kind of live from paycheck to paycheck. But what we're experiencing now, probably, and I will share that because the Do Drop In told me they were seeing 25 to 30% more people coming through, very first time ever. So I think this is going to be happening here too, our very first time. I guess it's 25% more people than we've collectively had through our system.
There were two ways for customers to pick up their hampers, a walk-up pickup and the more popular drive-through, which seemed like the best way to encourage and maintain social distancing. Major Laurie Mitchell of the Salvation Army says this new process worked extremely well.
We think it's going really well. Obviously, there are a lot of people. We had more people show up in cars than we were expecting, but we've got it kind of down to a well-oiled machine. My team's done a great job with getting everybody sorted out.
The only major problem that arose from the large-scale food distribution event was the amount of cars early on, something that they are going to focus on fixing for the next event in 2 weeks.
We weren't expecting quite as many cars as we've had, so next week we'll be more prepared for cars than for street traffic, foot traffic. So we're going to kind of look at our all of our logistics again and see what would be the best way to be able to get people off the street as quickly as possible.
And we'll probably go down to one walk-in because I think that where the demand is on the drive-through. People are coming with vehicles.
Michael Mahorovich, TBT News.
Cemeteries in Thunder Bay have begun to limit services. Most private cemeteries closed their gates to visitors just over a week ago, and city-owned plots are about to follow suit. St. Andrews and Riverside Cemetery on Oliver Road is already closed to the public and will remain that way for the foreseeable future. The Ontario government has passed an emergency declaration, and all city-run cemeteries, such as St. Patrick's and Mountain View, will close to the general public on Monday. The facilities will remain open for funeral services, but only for private ceremonies with limited attendees. Mayor Bill Morrow says he's going to try to find a way around this restriction so that people can still pay their respects.
I'm not completely certain that I agree with that decision. I'm going to revisit that with some of the senior management team here at the City of Thunder Bay, and perhaps we'll take another look at that. But just so the community is clear, funeral services are still allowed at the cemeteries up to and including 10 people.
Morrow says during these times it's important for people to have closure and to properly lay their loved ones to rest. Special needs teachers from Westgate High School held a parade today for their students. The teachers drove by the kids' homes to show their support during this pandemic. Avery McCrae reports.
15 special needs teachers from Westgate drove around the city today visiting 25 of their students. The cars came through like a parade with signs showing their support. Staff remained in their vehicles to practice social distancing while students remained in their driveways or on front porches. Mitchell Sagan, a grade 12 student at Westgate, shares what he did to show his appreciation for what his teachers are doing.
A lot. We got signs down the route, on the window and everything, and I really appreciate them doing this today.
It's a very family-oriented environment, and this extended break or learning from home has really put a cramp in our ability to communicate and be connected.
Workman says they've been creative to stay in touch with their students during the pandemic. On top of texting and phone calls with students, teachers have given online work through a program called Seesaw, where assignments can be done. Teachers have also used Microsoft Teams, an app that allows students and staff to connect through a FaceTime-like app. Workman says they've done what they can, but it isn't the same as being in the classroom.
We're their people. They connect with their peers, with the staff, they have routine, they're busy, they're involved, which is super important. So this learning from home doesn't have that same effect. It's very, although we try to make it as personal as possible with team chats and stuff, it's very hard to have that same level of connectedness.
Workman says working in a special needs classroom is like being part of a family. He compares not being able to see the students to not being able to see your kids. He says this was a shot in the arm that not only the students needed, but the teachers as well. Avery McRae, TBT News.
Nice gesture there by the teachers, and I'm sure a boost of morale for everyone involved.
Absolutely, when you're starved of interactive experiences as well, something like that. Cool activity to take part in. Fiona is warming up today.
Oh, finally. It's starting to inch back into more April-like weather.